Hi there and welcome to our video today on PSA screening. So today I'm just going to briefly outline what PSA screening is and how to have that conversation with a patient. But before we get started, it's really important that you are clear in your mind as to the difference between PSA testing and PSA screening. Okay, in the testing category, that's done where patients have symptoms. Okay, whereas screening is for your asymptomatic patients, and that's what we're going to be focusing on today. So it's quite a common scenario in general practice to have, say, an over 50s chap comes in, he wants to get his PSA tested. And it's really important to find out why he wants it done. Okay, because it's all too easy to go through the process of it, but it's actually really important to find out why he wants it done. It could be that his brother has just been diagnosed with prostate cancer, or it could just be that he read an article in the paper and he thought, I'll get that done. So he wants a PSA. You ask if he's got any symptoms and he says no. So you need to find out what his baseline knowledge is. What does he know? Does he know what the prostate is? Does he know what PSA is? So you can explain to him that it's a small gland that sits underneath the bladder. It's about walnut sized, and it's quite normal for it to get slightly bigger as men get older. It produces fluid that goes into semen, and the PSA stands for prostate specific antigen. And all prostate glands, every man with a prostate will produce some degree of PSA. Okay. Now then, I always say that PSA is not a perfect test. It's not particularly sensitive and it's not particularly specific for prostate cancer. So I always say that PSA testing is one side of what we do. If we're thinking about screening for prostate cancer, we've got PSA. We've also got DRE, the digital rectal exam, to feel the prostate. Again, it's not a perfect test, but those two things together can formulate some sort of risk, if you like, okay? But it's by no means perfect. It's really important that you explain, actually, Mr. X, a PSA test, it can come back raised when actually you don't have cancer, or it could come back as normal and reassure you when actually there is a cancer. So it's really important to communicate that clearly to your patient. The benefits of a PSA, so it can be used to detect a cancer before you develop any symptoms. However, broadly speaking, two main types of prostate cancer. One is a fast growing one that could have serious consequences, and one is a slow growing one that will never cause you any problems. And the PSA test can't differentiate between those two, so it's important that your patient understands that. Another downside to PSA screening in, again, asymptomatic patients is that you may get a false positive. So it's raised when actually there's no cancer there, and the next step would be further investigation, and that's quite invasive investigation, such as biopsy. And biopsy doesn't come without risk, particularly of impotence, particularly of voiding difficulties, or of incontinence. So it is very important that your patient understands this at the outset. Ultimately, it comes down to personal choice. You have got to outline all of these things to your patient, and your patient makes that decision. Make sure your patient is aware of the symptoms to look out for if he's worried about prostate cancer, so they will be your voiding symptoms and your storage symptoms. So to end the consultation with the patient, it's very important to make sure they go home with some written information, okay? Because obviously you've just given them an awful lot of information. It's a lot for them to digest. So I offer them a printed leaflet, or you could direct them onto your surgery website, for example. So I would give that to the patient and give them a blood form as well, and explain to them that they need to go home, read through the leaflet, have a think about things, and then if they do want to go ahead with the test, then they've got that blood form there. Okay, a few key bits of information that you've got to give them about the blood test is not to do any vigorous exercise 48 hours before the test. not to have any sexual intercourse or to ejaculate 48 hours before the test. It's also very important to exclude a current UTI because a urine infection can push the PSA levels up actually for several months. It would be worth doing a urine dip as well. And also if they've had a prostate biopsy in recent months, it's usually 2 months after or 6 weeks after having a prostate biopsy, then a PSA test can be done. So to summarise, PSA screening should not be routinely offered. So we shouldn't be offering a PSA test to asymptomatic men. It's only when they come and request it, that's when you would have this conversation. The benefits of a PSA are that it could detect an early cancer before symptoms show, and with early detection comes early treatment. The drawbacks, however, are that the test isn't very specific nor sensitive. There's high rates of false positives or false negatives. Ultimately, it's the patient's choice. At the end of the day, your job as their GP is to provide them with as much information as possible so that they can make a well-informed decision.